Guys, I'm going to walk you through muscles and body movements. The first thing that I want to talk about are the 5 golden rules of skeletal muscle activity. This kind of just goes into some basic things about skeletal muscles and how they work. For number one, typically all skeletal muscles will cross a joint. Okay, so you can see here you have your brachialis, and that will be crossing this joint at the elbow. The bulk of the muscle will typically lie proximal to the joint. So if this is the joint right here, proximal means closer to the body. So here's closer to the body. Distal would be further away from the body. All skeletal muscles have 2 attachments, and that enables them to shorten. They'll have the origin and the insertion. Skeletal muscles only pull. They do not push. This is because, as we talked about today, the skeletal muscles are going to contract and they're going to get shorter. When the muscle contracts and gets shorter, it will pull and it will not actually push. Okay, so they're only going to pull and get shorter. And then when it's doing this contraction, the insertion point will move towards the origin. Okay, so just like when you bend your elbow, that insertion where the tendon and connects the muscle to the bone is going to pull because that muscle is contracting towards the origin point. Okay, and that'll help your arm bend. So let's go through a couple of different movements. I'm just going to briefly read through these, but I will mention them and talk about specific muscles that do these. So if you need to reference them, they are here. I just wanted to give you an overview of some of the movements of the body. So flexion is bending, extension is straightening, rotation obviously is rotation. Abduction is to move away from the midline. Adduction is to move towards the midline. Circumduction is like a conical movement, so typically around a ball and socket joint. So you can think about like the ball and socket joint being like the point of the cone, and then like the circular movement from there, so like circling your arms. Dorsiflexion is the backward flexions of hands or feet, so like when you point your toes up or flex your fingers up. Plantar flexion or palmar flexion are going to be the flexion of the hand or foot downward, so pointing your toes down or pointing your fingers down. Inversion or eversion is going to be a tilt away from the midline. Supination is going to be rotating outward. Pronation is going to be rotating inwards, so either turning your palms up or your palms down. And then opposition only really actually happens when you push your thumb to your fingers. So those are just a couple of movements. Let's go through and talk about some of these muscles of the body. So here is the main muscles of the body. You are going to be required to know a good majority of these. You will be given a sheet a word bank that has that you should be able to study from to make sure you focus on the ones that you're required to know. Some of them you're not going to be required to know. All of these you have to know. And then these ones on the back side, you're going to be responsible for the majority of these, but you're not going to be responsible for all of these smaller muscles of the forearm, except for the brachioradialis. And then for your thigh, like you don't need to know the smaller portions of the hamstrings, etc. So I'm going to go through and talk you through all these muscles of the body. And as I'm going to go through, I actually have a couple of different stretches that, so if you're having trouble kind of picturing where this muscle is, if you want to try some of these stretches as you're watching, that might be a good way to learn it. So the head and the neck muscles. So let's first go through facial muscles. So the frontalis, orbiculus oculi, orbicularis oris, buccinator, and zygomaticus. So these are going to do a lot of the movements that actually give us a lot of the features of our face that humans actually use to interpret like emotion and things like that in each other. So the frontalis, that can be used to raise your eyebrows. The orbicularis oculi and the orbicularis oris. These are going to be circular muscles, so note that it has orbit, okay, in it, which is a circular muscle. The oculi will close the eyes, squint, blink, wink, and the oris is going to be for your mouth. Okay, so if you ever think of like the word ocular for eyes and oral for mouth, that's a good way to remember these. Buccinator will flatten your cheek. It also helps you with a little bit with chewing. And then the zygomaticus raises the corners of your mouth. So these are the smiling muscles. The chewing muscles, the masseter, will close the jaw and elevate the mandible. And the temporalis is a synergist. We will see this a couple of times. Synergist means they work together. So it works with the masseter to actually close the jaw as well. Some of the neck muscles, the platysma will pull the corner of the mouth inferiorly. Can pull from inferior means from below. And then the sternocleidomastoid will flex the neck and also help to rotate the head. So let's look at where these are found. So here's the frontalis, orbicularis oculi around the eyes. Here's the zygomaticus, so the smiling muscles, orbicularis oris, okay, around the mouth, masseter, and here's sternocleidomastoid. Okay, so those are the big ones that you need to know here. Let's go on to a couple of stretches. So one stretch that's pretty easy to do is to stretch your sternocleidomastoid. This is a really nice stretch, especially if you've been studying a lot. Here's another nice one that you can do if you'd like to work this muscle. Okay, so let's focus on the muscles of the arm and the shoulder. So we have the biceps brachii, brachialis, brachioradialis. These are going to help with elbow flexion. And so these are going to be what are going to flex the elbow. They all some of them do it more than others. The triceps brachii is an elbow extensor, okay, which means that it is going to be an antagonist or kind of not working together, working opposite the biceps brachii to actually straighten the arm. The pectoral major is going to be an adductor and flexor of the humerus. Adduct meaning moving towards the midline. And then on here you also have intercostal muscles. So these little intercostal muscles go in between the ribs. There's external and internal ones. And this is going to help with moving some of the air in and out of the lungs. So there's also the diaphragm that does this. That's the muscle underneath the lungs, and it does the majority of this, but you do get a little bit of the intercostals helping with lung movement or what's changing the shape of the cardiothoracic cavity as well to get air out of the lungs and into the lungs. And we'll talk a little bit more about that during the respiratory system, but I just wanted to share that now. Okay, so if you want to do any of these stretches, here's a really nice one on the left for the brachioradialis and also for the pectorals. Here's some additional ones. This one on the left is for pectoral and latissimus dorsi, which I'll talk about in just a second. We talk about the back and the shoulder a little more. And then here's another pec stretch. Here are a couple more: triceps, latissimus dorsi, and a bicep stretch on the far right. Okay, let's go on and talk about the abdominal girdle. So the abdominal girdle has a couple of layers of muscles. The one that you're probably most familiar with is the rectus abdominis. This is those center lines. So when someone has like a really nice six-pack or something like that, they usually have very nice rectus abdominis. And this is going to be responsible for flexing the vertebral column and also compressing abdominal contents, so important for a lot of those internal processes. And then you've probably also heard of the obliques. So there's actually two layers of obliques. You have the external and internal. This is going to also help with the flexing of the vertebral column, but it's also going to help with the rotation and the bending of the trunk as well. Okay, so those are going to be, there's two layers on the outside. And then inside, okay, is your transversus abdominis, which is the innermost layer, and this is also going to help with compressing abdominal contents. So here's a couple of stretches. These ones are great for the obliques. And here's a nice one for the abdominals and the external obliques. Okay, so let's turn to the back. So here are the muscles of the back and also some of the shoulder. So let's start first with the trapezius. Okay, the trapezius is actually it's kind of like a triangle-shaped muscle that goes down the back. It's going to elevate, depress, adduct, and stabilize the scapula. So it does a lot of different things. Latissimus dorsi is going to extend and adduct the humerus. Okay. So this one's also going to help with the movement of this bone right here. Okay, remember that adduct means moving towards the midline. So when that muscle contracts, it's going to move your arms towards the midline. And then the deltoid is going to be for arm abduction, okay? So the deltoid will contract and that will actually lift your arms up and move your arms away from the midline. I hear Dylan, he's trying to help with my lesson right now. So here's a really good stretch for the trapezius and the deltoid. Okay. So let's look at the legs now. So there's a couple of muscles that do the motion at the hip joint. So the first two that you've probably heard of before, you've probably heard of the gluteus maximus. This is going to be a hip extensor. Okay, so it's going to help with the extension of the at the hip joint. Gluteus medius, you might not have heard of this one. So this one's actually more on the side and underneath the gluteus maximus, and it's going to help with hip abduction. So this is going to also steady the pelvis when walking, but hip abduction means that it is going to move or lift the hip or the leg away from the median line. You also have a couple of other ones. Okay, so let's look at the adductor. Okay, so here's the adductor right here. These are going to adduct the thighs. Okay, so this is going to move towards the midline. Another one of the muscles is the iliopsoas. This is going to help with hip flexion, so the bending. It also is important for keeping the upper body from falling backwards. So this is going to be right here. There's a couple of muscles that work together. Okay, so here's a couple of stretches. Here's a good one for the glutes. We'll talk about the hamstrings in just a second. Here's the iliopsoas, also known as the hip flexor. Here's some adductor stretches. These are some nice ones. Hip or some muscles of the lower limb. So we have our hamstring group, our sartorius, and our quadriceps. You've probably heard of these before. The hamstring is going to be for thigh extension, so straightening, and knee flexion. It's made up of a couple of smaller ones. Oh, hold on a second. What do you want, Dylan? Here you go, babe. Dylan wants to help me out today. So there's three smaller ones. You don't need to know the three smaller ones. You just need to know the group in general. The sartorius is going to flex at the thigh, so bend at the thigh, and the quadricep is going to extend. So note that here is where the hamstring group is. It's going to be on the back, and then the quadriceps are going to be on the front. Okay. So let's look at the ankle and the foot. There's a couple of different muscles here. So there's the tibialis anterior. So this is dorsiflexion. Dorsiflexion being that it's going to help lift up the toes and foot inversion. The extensor digitorum longus. This is for toe extension and also dorsiflexion. Extending the toes and also lifting the toes up. The fibularis muscles, this is for plantar flexion. So this is going to help point the toes down and foot eversion. The soleus is for plantar flexion, pointing the toes down. And the gastrocnemius is for also plantar flexion, but it also works to flex the knees. So here is your gastrocnemius. You've probably heard of them as the calf muscles before. So if you want to stretch any of these muscles, here's a couple of good places to stretch them. So you can see back here, here's a good calf stretch. Here's a good tibialis anterior. Okay, and those are the muscles of the body that you're going to be responsible for. So please make sure you study a word bank. There is a game to play on haiku, and your coloring pages should also be good practice. Okay, let me know if you have any questions. Have a nice night, guys.